My name is Sonia Ratan, and this is my presentation on the QI plan. The quality methods within healthcare typically fall under four major categories. These four categories are the structure, the process, the outcome, and the patient experience. The structure measures and assesses the structure and characteristic of a healthcare setting. For example, is the intensive care unit of a particular hospital have a critical care specialist on staff at all the times? The process, which measures, assesses the services provided to its patients. Does the doctor ensure that the patient receives recommended cancer screenings? The outcome, which measures the patient's health resulting from the treatment. For example, what is the survival rate for the patient who experiences a heart attack? And the patient experience assesses the quality based on patients' feedback regarding their experiences. For example, do the patients report that their provider explains their treatment options in ways that are easy for them to understand? The models of the QI methods. There are several models of the QI methods. The PDSA implement in 4 steps. PDSA stands for plan, do, study, and act. Plan means that the change is to be tested and implemented. Do means to carry out the test or charge. The study is based on the measurable outcomes agreed before starting out, collect data before and after the change, and reflect on the impact of the change and what was learned. And act means to plan the next change cycle or the full implementation. The model of the QI method. Here we are to understand the Lean Six Sigma. Lean Six Sigma focuses on eliminating defects, reducing wastage by streamlining a process. In healthcare, a defect can be a difference between life and death. Using Lean Six Sigma to improve patient safety by eliminating life-threatening errors. Lean Six Sigma uses define, measure, analyze, improve, and control, a 5-step approach to process improvement. The models of the QI method. Well, the models of the QI method help us understand what we are trying to accomplish, the required quality improvements, and the specific group of patients that will be affected are well defined. The model of the QI methods also tell us how we will know that the change is an improvement. The change should be time specific, measurable improvement for which the aims are set. And what changes can we make that will result in improvement? For each change to be tested, specific quantitative measures are established to determine whether or not the changes lead to improvement. The role and importance of patient satisfaction. Patient satisfaction affects all clinical outcomes. Improvement in patient satisfaction improves clinical outcomes. Several factors that affect your bottom line are linked to patient satisfaction, including the patient growth, the physician bonuses, fruitful partnerships, etc. Patient satisfaction leads to customer loyalty. Consistent profitability. This is something that is estimated in the USA, where a loss of a patient due to dissatisfaction can result in the loss of over $200,000 in income over the lifetime of a practice. Increased staff morale with reduced staff turnover, which also leads to increased productivity. There are reduced risks of malpractice suits, and increased personal and professional satisfaction is very important. Patient experience encompasses the range of interactions that patients have with the healthcare system. This includes their healthcare plans and from the doctors, nurses, and staff in the hospital, physician practices, and other healthcare facilities. Patient experience. Patient engagement comprises shared decision making, giving patients access to information, and achieving the best possible results by empowering patients to take care of their own health. Satisfaction for both the patient and the staff. This is a measure of contentment based on the perceived quality of healthcare received by a patient. The clinical effectiveness is often described as a process or application that focuses on optimizing patient care quality while finding clinical solutions that are grounded in evidence. Personalization in healthcare is not only limited to experiences that are specific to one's preferences, but also offers a personalized treatment plan. Patient safety defines as the prevention of errors and adverse effects to patients associated with healthcare. Admission and discharge process of treatment matter to patients as much as the care delivery itself. Admission and discharge process, the sixth most frequently mentioned variable, shapes the patient's experiences by creating the first and the last impression of the facility. Here we can see an example of the patient experience. It is based on the discharge process, the ease of appointment, the facility access, the communication, the people involved, the various policies, the values, the vision, and the perception. The use of statistics. This involves proportions and percentages, the ratios, means and medians, and the counts. Proportion and percentages are most commonly used quality measurement constructs because they are not only easy to construct but easy for most people to understand. For example, the percentage of people acquired infection after a particular hospital stay. Ratio. These are used less frequently than proportion and percentages because the numerator may or may not be contained in the denominator. Example, the ratio of kids to adult treated by diabetic center of the hospital. Means and medians. Rarely do we find in healthcare quality metrics in the form of means or medians. For example, these metrics are used for situations such as wait times and phone hold times. Counts. Sometimes quality indicators are presented simply as a count of adverse outcomes. These are rarely presented to the public as they can be easily misinterpreted. For example, the number of people that are served by a county hospital. Let us consider the Chaparral Regional Hospital Task Force. The task force will be led by our QI task force that will include representatives from the Chief Executive Officer Office, the medical directors, physicians, nurses, medical assistants, and lab technicians. It will also include the patient representative and several staff members. The community health workers, health educations, and patient advocates will also be involved in the task force. It will also include social workers, case manager, medical record staff, the finance director, billing, and the coding staff. The Chaparral Regional Hospital Survey design. The Chaparral Regional Hospital Survey is designed to look at following attributes on a scale of 1 to 5, with 1 being the lowest and 5 being the highest. This is based on the appointment, the communication, the staff, facility, and the overall satisfaction with the practice. Under the appointment, they're looking at the ease of making an appointment, the availability of an appointment, the efficiency of the check-in process, the wait time in the exam room to see the physician. The staff involves the courtesy of the receptionist, the concern of the nurses, the experience while being attended by a physician, the courtesy of the lab staff, and the billing staff. The communication involves the phone calls that are answered promptly, explanation of the procedures, the ability to obtain prescription refills by phone, and the test results that are being reported on time. This also includes effectiveness of the health information materials. The facility involves the hours of operation which is convenient to the patient, the adequate parking, signage, and directions which are easy to follow for the patients. And the overall satisfaction involves the satisfaction with the practice, the quality of the medical care that is being delivered, and the overall care from the provider or the nurse. Implementing the results of the survey involves finding the gap in care in 5 major attributes using the surveys to identify the areas needed the areas that need most improvement, to allocate the resources for making these improvement, to monitor the improvement of the attributes, to revisit the results, readjust the process and the resources, to work on continuous improvement, to run post-implement survey to gauge the impact of these results. Thank you.